Thank you very much for inviting me to be here. I'm a general surgeon from Los Angeles, and I have no disclosures. So last year when I was giving this talk, my children were nice enough to make me a little sign, and they took a picture with it so I can include it in my talk. This year they made a sign, but they would have nothing to do with taking the picture. So I think the attitude is going to keep growing. So I think next year, Dr. Felix, if you'd make the sign with me, we can just take our own picture. I think it's going to work better. So as you all know, Botox is the brand name for botulinum toxin A. I'm going to refer to it as BTA for this talk. And there are different kinds. Different companies make them, and they're all a little bit different. Botox is what we have in our hospital, so that's mainly what I'm going to focus on. And Botox was really discovered in the 1800s when it was found in infected sausage, and that's how it got its name. And it blocks the release of acetylcholine, and it prevents muscle from contracting. So why should we use BTA for abdominal wall? Well, it does many things. The first thing that it does is that it helps us with our hernia repair, and it helps in many different ways. Once you inject it, it paralyzes the muscle. It takes effect within 2 or 3 days, and the maximal effect is at 2 weeks. But Dr. Ibarra showed a study where you get an effect up to 4 months. I'm sorry, up to 4 weeks. And then afterwards, at about 3 months, the effect starts to decline. So here's one of my patients. That's his hernia on the day of the Botox injection. And then you see a month later how lax his abdominal wall has become. This man had a very bulky abdominal wall. He's a bodybuilder. And it was rock solid before. And look at how pliable it became with that Botox afterwards. And the Botox really helped me repair his hernia just with a reef stopa repair so that I didn't have to cut any of his abdominal wall musculature. There's another way that BTA helps with hernia repair. It increases the intra-abdominal volume. It really lengthens the lateral abdominal wall, and this helps to reduce the size of the hernia defect. In this study, you see really good images of the pre and post Botox showing the changes in the abdominal wall and the decrease in the size of the hernia defect. Here's what it looks like for a patient, and you see a noticeable difference at about 2 weeks, and patients actually feel a difference. So you have to warn them about it, because in the beginning I wasn't, and they would call me at 2 weeks very frightened at the changes that were happening. Another thing that BTA does is that it's probably helping with postoperative pain. Now we know that it has effects on pain transmitters, and it also affects many factors that are involved in pain, inflammation, pain sensation. So there is some studies done on this, but more is needed. But really, in this world of opioid addiction, I think we have to look at very creative ways of doing multimodal pain control. And I think BTA has a good role for our patients that are going to have laparotomies. And my patients themselves actually report to me that they have less pain those 2 weeks that they're waiting to have their hernia surgery than they had before. The third thing that it can do is to help hernia prevention. So normally, when the lateral abdominal wall complex is active, it causes lateral retraction, and that's opposed by the linea alba. So when we do anything where we're reapproximating the linea alba, whether it's repairing a hernia or just closing a first-time laparotomy, we need time for that linea alba to remodel and scar together. Well, if you inject Botox and there's paralysis of the lateral muscle, it's going to give the linea alba time to heal. And this could decrease hernia recurrence or even hernia formation. This study was done in rats to show that those that were having primary laparotomy, if they had Botox injection, they had a significant decrease in their hernia formation compared to those that did not. It hasn't been studied in humans, but I think it's very promising. So this is the technique that we use in our hospital. This is me and Dr. Tina Hardley. She's one of our interventional radiologists who can do anything under ultrasound. So when the scanner breaks, everyone looks to her. So I asked her to help us with this. We do it in the IR suite. We use some sedation with local anesthesia, because after all, we live in the United States and people like sedation. We give some a little bit of local, and then we mix 100 to 150 units of Botox and 100 milliliters of saline. We're using now 150 units on each side for almost every patient, unless they're very frail. Then we'll go down to 100 units. And we basically use ultrasound to find 3 locations on the lateral abdominal wall, and we identify the 3 layers of the muscle, and we use a larger needle to traverse at an angle so we can get through all the layers, and we use the ultrasound to make sure we don't violate the peritoneum. And you see an approximate where those 3 areas tend to be in most patients, depending on where their hernia is. So here is a picture of the layers of the abdominal wall represented by the colors of the Armenian flag. The red is the external, the blue is the internal, and the orange is the transversus. And basically you see the needle right now in the external, but first you have to put it into the transversus, start injecting, and you see the liquid solution bathing the muscle fibers, and then you slowly pull back as all 3 layers get infiltrated. Here's an image that I really like because you see the needle going into the transversus, and what you see underneath is the bowel peristalsing. And I think that this is why we like using ultrasound, because it's very easy to poke into the peritoneum, as you can tell. So avoiding that would be good. So is BTA safe? The answer is, so far it looks like it is. There have been no reports of complications when people have used it for the abdominal wall. But there are potential complications that can happen that we all have to watch out for. How much BTA you use really depends on what formulation you use. They're all a little bit different. For us, like I said, we use a total of 300 units. Botox is recommended not to go over 400 units in a 3-month period. And really getting to the lethal dose is too expensive, so it's probably very hard to do. One of the obstacles is cost, because most insurance companies are not paying for it because it is off-label use. But hopefully as evidence grows, this will change. But this seems to be the biggest problem that most people have. Now, I'd like to conclude by saying that I work in the heart of Hollywood in Los Angeles, and I wanted to bring a little bit of Hollywood here to Seattle today. So I made a little video, and in true Hollywood fashion, I'd like to present all of you guys with this fabulous musical production called Botox Doc.
Hey, Doc.
Yes, nurse?
Think you could fix this hernia?
Sure can. I'm a Botox doc, announcing Botox rocks. Not trained in plastics, makes it fantastic. Surgeons don't despair, injected everywhere. Desperation, Botox is salvation.
Here's the toolbox with the Botox.
I'm a Botox doc, announcing Botox rocks. Not trained in plastics, makes it fantastic. Surgeons don't despair, injected everywhere. Desperation, Botox is salvation. I fix big hernias in the surgery world. 10 previous operations don't scare me. I read old up reports and I check out the scan. Then I know how to fix it exactly. Ultrasound, then Botox. And 1 month later comes the tar. I'm a Botox doc, announcing Botox rocks. Not trained in plastics, makes it fantastic. Surgeons don't despair, injected everywhere. Desperation, Botox is salvation.
I'll get the Botox from the toolbox. I'll get the Botox from the toolbox. I'll get the Botox from the toolbox. I'll get the Botox from the toolbox.
Hernia.
Genius. Absolute genius.
That's a standing ovation.
Thank you. I'd like to thank my nurses and MAs that helped me with that, my cousins that helped me with the production, Dan Popowich that put in the subtitles, and that was my email. If you guys want to send either questions or send me gift cards so I can get voice lessons, please do so.
Awesome. Thanks, Talar.
All right.
A new bar for speaking.